Well, the very first moment that I realized that there was a birth defect, Cassidy was a cesarean section, and the doctor held her up only this high over the drape for me to see when she was delivered. Once they whisked her away, he said, "Sally, Cassidy has a cleft in her lip. It's not a bad one, but it's a cleft."
I noticed that my face looked different because of the deformity that I had. And it was always kind of a problem because I'd get made fun of a lot. Throughout my childhood and even still now, I'm very self-conscious about my face. I'm very self-conscious about the way I look. You still kind of hold on to that insecurity from being a child and having people say, "Oh, you look different."
My dentist locally actually recommended Dr. Valuathan. The first day that we met with Dr. Valuathan, he immediately called up to Case Western, got us into the Craniofacial clinic, and from that point on, he really was the advocate for my child.
The first time I went to Dr. Valuathan's, he's a really funny person. He makes you feel comfortable because he knows how to talk to younger people.
Cassidy had obviously the cleft lip condition, which often affects the position of the upper jaw. And when the time was right, we had to go ahead and line up the teeth and actually have the surgeons help us. In fact, Dr. Cassidy did the case where we went ahead and we got the upper jaw and lower jaw to fit together. So the final result that you see is, again, a combined effort of the entire team. And when I see Cassidy, she's a star in the making. I mean, she's talented, she's well-spoken, she's got a great heart, and she's overcome everything that life has put in her way.
He is very insistent on his staff catering to the needs of his patients and not just for their teeth. He says if you have a girl with very low self-esteem, help her to realize that she's beautiful.
You have to have a team wherever you decide to get your child's treatment. At the Craniofacial clinic, you literally go into a room and each doctor files into that room one after the other. At the end of the clinic day, those doctors all sit down and they discuss your child specifically, and you get a letter that specifically tells you everything that was discussed about your child and what the next course of treatment is. When we first started going to the clinic, Dr. Gosain used to make her sing every time we went, or he wouldn't see her. Dr. Valuathan started doing that in his office. Every time we went to the office, he would ask her to sing. So they really become involved in their life and understanding what they're going through at that point in time.